Hello and welcome to Dragon Bites, the paediatric podcast aimed at paediatric trainees or anyone interested in child health. I'm Asim, one of the paediatric trainees here in Wales and one of the presenters for Dragon Bites. This week we've got another one of our grid application episodes for you, focusing this time on the Metabolic Grid application. We're joined by two special guests, Dr Richard Curnock, who's one of the Pediatric Metabolic Disease Grid registrars working in Manchester, and also by Dr Arubabha Ghosh, who's one of the consultants in metabolic diseases working in Manchester also. Even though it's 2020 and there's not currently an application open for Metabolic Grid, they were kind enough to record this podcast for us, ready for you in the future when that post opens up. So if you want hints and tips on how to apply for the Grid Metabolic post, or if you're just interested in finding out more about metabolic diseases, then have a little listen to this podcast. Anyway, let's get started. So, hi there, my name's Asim. I'm one of the hosts for Dragon Bites, and we're doing an episode today about applying to the Metabolic Grid specialty program. And I've been lucky enough to join by two special guests. So, can we start with yourself, Richard? Do you mind just giving us a quick introduction?
Yeah, hi. So I'm Richard Curnock. I'm an ST6 grid trainee in Manchester.
Amazing. Thank you, Richard. And we've also got NABA here.
Thanks, Asim. It's a pleasure to be here. So I'm Arubabha Ghosh, and I'm a consultant in Pediatric Inherited Metabolic Disease, also in Manchester.
Can I just thank you both for being here? We really appreciate it. And hopefully we'll be able to encourage a bunch of trainees to consider Metabolic Grid as a future career. And for those who are already thinking about it, we'll be able to give them a few hints and tips about how to improve their chances of getting an interview and what to do in the interview. Does that sound okay?
Yeah, sounds great.
Yeah, fantastic.
Fab. I thought before we got started, it'd be nice to get you to know you both a little bit. So is it okay if we start with yourself, Richard? Do you mind just telling us a little bit about your medical career to date? How you chose pediatrics, how you came to choose metabolic disease, and so on.
Yeah, hi. I did my undergraduate at Manchester University, and then after that, I did my foundation in Leicestershire, Northamptonshire, and worked in my hometown of Kettering. And then I did an FY3 year and moved down to London to do a diploma in child health at UCL, and did that full time for a year. And then I started my paediatric training in South London, and spent 5 years there. And then I was still technically a part-time student at UCL, so I converted my diploma to a master's in my ST4 year, and then applied to Grid in ST5 and got a post in Manchester, and then moved up for ST6, and that's where I am now at the end of ST6 in Manchester.
Wow, incredible! The only thing I know about Kettering is that's where comedian James Acaster is from.
Yeah, that's right. Yeah.
um,
Big fan.
what was it that drew you to pediatrics in the first place?
Yeah, no. So I did it's in my last rotation of foundation. It was pediatrics, and I just found it so supportive. It was really great team working. All the consultants were enthusiastic and really encouraged me. And I enjoyed the job so much, and I knew then that pediatrics was for me. So that's why I decided to do pediatrics. But I was a little bit too late at the end of my foundation to apply immediately. So that's why I looked into doing a postgraduate diploma or certificate in child health, and that's what I ended up doing in my FY3 year.
Oh, that's it. I was going to ask you how come you chose the diploma route of coming into things. Do you think, because what I often find is that actually getting that foundation pediatric experience is the clincher for a lot of people. So was that the case for you then? And is that why having that as your last job might have been what delayed you applying?
Yeah, I think so. I did really enjoy pediatrics in my medical student time as well, and I made sure that I chose a job that contained pediatrics as part of my foundation. But unfortunately, it was the last one, which I didn't have very little choice over. So at that point, before doing pediatrics, I was considering a career in core medical training. I was looking at potentially going to New Zealand for a year, but by the end of my foundation, I realised that pediatrics was the way. what I wanted to do. So I looked at how I could bolster my CV towards paediatrics, and I felt that after being in Leicestershire and Northamptonshire, I wanted to sort of move into a bigger city, and London just had that appeal. So I moved to London and looked at universities there to do a diploma in child health.
Wow. So, after picking Peds, which is of course clearly the best decision of your life, what was it that drew you to Metabolic Grid?
Yeah, so I didn't really have a lot of experience in metabolic diseases when I applied for Grid. I had done a job as an SHO at the Evelina Children's Hospital, working within the metabolic team there, and they were just really fantastic. They encouraged the SHAs each week to present a different condition, and although I found that quite a nerve-wracking task, I learned so much about the biochemical pathways of the human body, and found it fascinating going back to basics and applying that knowledge to metabolic disease and management. I also like the balance between managing sort of chronic multi-system disease, but also the acute emergency management which metabolic offers. And yeah, I found that a lot of the metabolic consultants are all sort of excellent general pediatricians and able to take that sort of holistic approach towards patient management, not just focusing on the nuances of that particular condition. And there are plenty of research opportunities, and you can get involved writing case reports and case series. And there's a huge multidisciplinary team environment as well. So you've got you're working very closely with dietitians, but laboratory scientists, geneticists, specialist nurses. And I really felt the team really gelled together and went above and beyond to provide excellent care. And I found that really rewarding, and that's what I wanted to be part of. So after doing that job, I knew that that's what I wanted to do.
Dear Lord, if that doesn't sell people on metabolic disease, I don't know what will. That was incredible. I mean, it's interesting that you said that you mentioned the acute management. For most junior doctors, their nightmare scenario is a complicated metabolic disease case coming in through the front doors that needs acute intervention. It's really terrifying. But you actually you find that something that you enjoy in your work.
Mm. I suppose it's having that balance, isn't it? It's finding a career where if you do enjoy a little bit of acute management, that you've got that opportunity. You've got that opportunity there within your specialty. You're not just going to be in clinic 100% of the time.
Yeah, amazing. So what did you say you were an ST7? Is that right, Richard?
Yeah, well, so I'm the end of ST6, so I'm starting ST7 in from September.
Amazing. So does that mean you're now 1 year into your metabolic grid training?
Yeah, that's correct. Yeah.
How long have you got left? How long is metabolic grid training?
Mm. So I think for most trainees it's 3 years. Um, Possibly if you've got lots of previous experience, then it could be done in two. Although I think most trainees that I'm aware of do it in 3 years. So yeah, I've got another 2 years left.
Amazing. And one last question, just about to get to know you a little bit better. What do you find to be the most rewarding part of your job?
Yeah. Well, I feel like the team that I'm really working in is excellent. Every day when I leave work, I feel that we provided the best possible care. Certainly, all the consultants and other professionals, all the dietitians and the specialist nurses, they're just absolutely passionate about what they do. I really like getting to know families right from the beginning. A lot of our patients are sort of diagnosed from birth, from newborn screening, and we see those children grow up or transition into adulthood. And I suppose another aspect is that some of our patients also have life-limiting conditions. So there's sort of palliative care skills, which adds an additional layer to the job, and supporting families through that journey as well is really rewarding.
Um, I suppose the next thing to do to kind of establish is to get an idea as to what the metabolic grid program involves, because a lot of trainees won't necessarily have been exposed to this. In Cardiff, we're fortunate enough to currently have Dr. Graham Shortland to discuss these sorts of things with, but we won't have him for very much longer because he's heading towards having a nice, easy retirement now. But that won't be the case for everywhere. So, is it okay to discuss with you both what the training involves in the future. Is it okay to start with yourself, Richard?
Yeah, sure. I can tell you what my day-to-day job would involve. We have metabolic inpatients that we manage on the ward, but also we see patients that present acutely to A&E with metabolic conditions. Um, I also get the opportunity to sit into clinics, and also get to run my own clinic as well, which I try to do once a week. Um, so we also have the newborn screening lab within Manchester. So if we get any screen positive patients from there, then we will try to see them as soon as possible. And I will either see them independently with support from dietitians, or I'll see them supervised by a consultant. We also get involved with giving advice to other hospitals, because many of our patients present to local DGHs. So we'll be giving advice to those hospitals. We also have multidisciplinary team meetings. So we have 2 of them a week, one for general metabolic and also one for lysosomal storage disease patients. And then we also have morbidity and mortality meetings as well. And then there is also departmental teaching that we have once a week within the department. And then we also help out on regional teaching days as well.
That all sounds really packed. How is that split up into an average week? Because that seems like a lot to do.
Yeah. I think a huge chunk of it is managing the patients on the ward. It's not just myself, so I'm supported by an SHO and another registrar that assisting me with that, and we also have the consultant of the week who would be responsible for doing ward rounds.
Amazing. Um, so if that's your day-to-day sort of week-to-week work, over the actual grid block, what posts is it that you have to complete?
Mm. So I think one of the difficulties with metabolic disease is there are very few centres which can train grid trainees. So NABA can correct me if I'm wrong, but I believe it's just London, Birmingham, and Manchester that have the ability to train grid trainees. So with London, you have 2 centres. You've got Great Ormond Street Hospital and Evelina Children's Hospital, where there are 2 different metabolic teams that you would rotate between. But in Birmingham and Manchester, there's just the one centre in each location. So because I'm a Northwest trainee, I stay at Manchester for my duration of the training.
And do you just have does your training just involve metabolic posts? Do you have to do posts in any other particular speciality?
It just involves metabolic, although I'm also on call, do on calls as well, and that will involve covering other specialties in evenings and weekends and on night shifts.
Amazing. And are there any special requirements that you need to have completed by the end of your training as in grid?
Yeah, so I think recently the Royal College has released a sort of subspecialty learning outcomes. So there are a number of them focusing on managing acute emergencies and understanding of different conditions. There's also focus on diagnosis and the newborn screening, and then working with other local hospitals as well, and research. When you look at the number of conditions, they're split into different groups. So I try to tick off patients as I go through and sort of build a logbook of patients that I'm encountering on the wards and in clinic.
Brilliant. Thank you, Richard. NABA, we've spoken about quite a few things there about the actual day-to-day working in a metabolic grid post. Was there anything that you wanted to add to that?
So I think so, Richard. You were talking about training centres. So yes, you're right. There's so the training centres where there are grid posts offered are Manchester, Birmingham, and then in London the Evelina Children's Hospital and Great Ormond Street. And because partly because of the geography, it's quite it's not necessarily easy to you stay in the same centre for the duration of your training. Now, it's not impossible that you could, if you were able to swap with another current grid trainee, work out a system where you spent some time in another centre. And that may well be valuable for various reasons. So the different centres perhaps have a slightly different cohort of paediatric metabolic patients. During my training, I thought about doing that, but for one reason and for various reasons wasn't able to. But I did spend a bit of time going to clinics at one of the other centres, just to get an idea of the kind of different cohort of patients they have over there. So I went to some neurometabolic clinics, and that may well be valuable for other trainees. So in Manchester, we have a big cohort of patients with lysosomal storage disorders, and it may be valuable for other trainees to come here. So there's a certain amount of flexibility that that might be an advantage. But generally speaking, yeah, trainees stay in the same region for their duration of their training. And yeah, like you said, in terms of specific requirements, so I think Richard was referring to the recent progress curriculum outcomes, and of course you have to get your generic level 3 competencies as well. It's difficult with rare disease because and you'll be Richard will be aware, you've got a logbook of many different conditions to see, and you may find that there are the odd condition that you might not have seen by the end of the grid training, or some of them you might have only seen once or twice, and that's kind of the nature of rare disease, really. So that's a different challenge in itself. But overall, I think it's a rewarding program.
That's really interesting. It hadn't even occurred to me that different parts of the country would have different cohorts of patients for rare diseases. And I suppose what's your take then on if you're doing a grid post specifically looking at rare diseases and it's part of your outcomes, is there a degree of sort of understanding if there are certain rare diseases that you have in your logbook that you haven't come across by the end of your grid training?
Yeah, I think so. And that was part of the reason why I went to a few clinics at one of the other centres, because I wanted to try and see a few different groups of disorders, I think. So, I think, and part of it is really also to do with what the centre specialise in. So historically here, we've always been strong in particularly research for lysosomal diseases. So I perhaps had quite maybe my logbook was perhaps weighted a little bit too much towards lysosomal, and so going to some clinics elsewhere helped kind of just even things out a little bit.
Amazing, thank you. And I suppose the next question I had for you, Naba, metabolic diseases is about as specialised an area as specialised areas get. How could a trainee go about gaining experience in the area if they're thinking of considering it as a future career to explore?
Yeah, so I guess the common saying or the cliche saying is that they are individually rare but collectively common, and so you're absolutely right. Most trainees won't get a chance to have worked in a metabolic centre or done a metabolic rotation. But I think over the course of your core training, you probably will come across some patients with metabolic disease or suspected metabolic disease, and metabolic children with metabolic disease they don't present to us. We're not the ones that make the diagnosis often, they present to general paediatricians, and it's about general paediatricians being aware of metabolic disease. So I think you will come across the clinical side of things. But I think if you find that interesting, and if you find metabolic disease interesting, then talk to the person in your regional metabolic centre. We're a very friendly bunch, and we do tend to get very excited when we hear that trainees are interested in metabolic medicine. So come and talk to us, and we arrange to come and attend clinics with us, meet our MDT, meet the dietitians, meet the lab, come to study days that we organise. So here in the Northwest, we organise a regional study day every couple of years that's aimed at general paediatricians. That's an opportunity for you to learn a bit more about metabolic disease, but also meet all the people involved. Come to conferences. So there's the British Inherited Metabolic Disease group. They run an annual meeting. So ours has been postponed this year because of COVID. But I would suggest attending that because you will get to know people. One of the advantages perhaps of being such a niche specialty and such a small specialty is that actually there's only so many of us, and it's you can get to know most of us fairly quickly, and make some contacts and arrange to find out a little bit more about metabolic medicine and get involved in projects and that sort of thing.
That's brilliant. Thank you, NABA. Richard, did you have anything to add to that?
No, I think you covered a lot of the points there. I just echo saying that if you're in a deanery where you don't have metabolic diseases as a possible rotation, then there are plenty of overlap with other specialties, neurology, genetics, hepatology, cardiology, and respiratory. You're bound to encounter metabolic patients in those specialties, and general pediatrics and community pediatrics, you're going to see metabolic patients as well. So just because you haven't done metabolic diseases as an SHO doesn't mean that you can't apply for GRID.
That's brilliant. Thank you very much, Richard. So now I think it's time to get to the crux of the matter. Let's say we've got a trainee out there. You've both convinced them that metabolic disease is the way to go. They enjoyed the cases they've seen, and they're really interested in this. So let's. Is it okay if we start with yourself first, Richard? What general advice would you offer trainees who are planning to apply to Metabolic Grid?
Yeah, good question. I would really encourage them to look really closely at the shortlisting criteria for interview. It goes through different sections which are quite relevant to your CV, such as like teaching and management and audit. And you don't have to have huge research projects or lots of papers to your name. It's all about trying to score as many points as you can. So I'd sit down, look at your CV, and see what you can improve with the time that you've got available to you before the application.
Amazing. And is there anything specific that tends to help more with metabolic grid applications? Anything in particular that they can do to try and score a bit higher on their CV that would also be better recognized by the metabolic grid panels?
Well, I mean, what I would say is that in terms of shortlisting, so we're looking for people who are genuinely really interested in metabolic disease, but we're also looking for people with good generic skills. So actually, all of those things will count. If you've got teaching experience and you've organised teaching, leadership experience, those things will count. They'll get you points. And if you have done some projects, and it may not be that you've written a paper on or had postgraduate degree qualifications. And in fact, the majority of the trainees I think that have come through recently have not had postgraduate qualifications before they got into GRID. So that's not that isn't essential, but what it might be good is if you've got projects, you may find, because there's so many opportunities, that you could get abstracts submitted and get a poster or maybe a presentation. And it's worth, if you've got the interest and you've managed to think about it early enough, then, because these things take a little bit of time, you might be able to get something like that, and that would certainly get you an extra point or two.
Amazing. Richard, did you have anything to add to that?
Yeah, I would just say that if you know any metabolic consultants in your area, I would really contact them and say that you're interested in applying for metabolic disease, and see if there's any projects or audits you could do to help bolster your CV.
Amazing. So, I suppose this is either to yourself, NABA, or Richard. Should we start with NABA? Do you think that is it more useful to have projects that perhaps have, projects or teaching or leadership that have a metabolic slant to them, compared to just any other specific teaching they might have done?
I guess what I would say is that yes, it is good to have a metabolic slant to them if you can. But we don't expect trainees to have huge amounts of metabolic experience. If you, as Richard suggested, I think is a very good idea. If you've been in touch with the metabolic centre and done something with that centre as a project, that would be, that's great. But we're equally, it's important to have projects that are just of good quality. So, it could be, something that you've done in your centre that's good quality, and it shows that you have the generic skills to do that. Will look good. So, I guess it's important to have, a few things that are thoroughly done and completed, of good quality, audit cycle completed, that sort of thing, rather than have lots of dotted projects that are kind of not all very complete. And it's about quality, I think. But yeah, if you can get a metabolic slant, then that's great. But we're looking for all-round good candidates, I think.
So proving that you can carry out a high quality QI project is probably a more useful skill to have. But if that can be done with something metabolic related, that's just bonus points.
Exactly.
Amazing. Thank you. So I suppose one thing when it comes to grid applications is that, often you have to think about a lot of these things early on. You can't fit in a QI project a couple of months before you're due to send in your grid project. So I was just wondering if either of you knew, if we could start with yourself first, Richard, of the sort of low hanging fruit, so to speak, the easy things that you can do quickly just to get those few extra points on your grid application form.
Lots of resources we can get online now. So you could do the Good Clinical Practice course online. You could also think about if there's any metabolic patients that you've encountered that you could write up as a case report, and going to any of your local metabolic study days just to get a feel for what metabolic disease is about.
Yeah, thank you, Richard. And NABA, do you have any other ideas or suggestions?
Yeah, I suppose low-hanging fruit's quite, it's quite difficult. But if there are things that, it's always worth thinking about what you can do in your centre to improve things. So, we've suggested talking to your regional metabolic centre and what projects they have, but it is always worth thinking about what can I do in my unit to raise awareness of metabolic disease. I've had trainees who haven't necessarily applied to Metabolic Grid, but have come here and really enjoyed their rotation here, and then gone back and been, organised metabolic related teaching and that kind of thing, or have gone back and reviewed their practice in their unit. What are the guidelines for, let's say, investigating suspected metabolic disease on the neonatal unit or something like that. And that's worth thinking about. A lot of our guidelines are published or are online, but units often want to have some kind of a resource for them to use locally, and it's worth having a look at that, seeing does it make sense, does it need updating, and that kind of thing. I guess one of the things I did, as an example, when I was ST4 or 5 or something, was so I made a hypoglycemia guideline and a little hypo pack that you could use in A&E to try and sort of make it more streamlined and efficient to screen for hypoglycemia, that sort of thing. So there might be things that you can do in your own centre as well.
That's actually so. Thanks both. Those have been some excellent suggestions. So I suppose what we need. And I just wanted to say thank you to Richard and NABA for recording that for us. Have a listen in again in a few weeks' time, where we'll be releasing the second half of that podcast, where we go through interviewing for the Metabolic Disease Grid programme. Thank you for listening to Dragon Bites.